Quality assurance in microbiology lab. Why should stains and reagents not be used beyond their expiry date? Answer is expired stains and reagents may deteriorate, causing abnormal turbidity, discoloration, poor staining reactions, and inaccurate microbiological results. Why are control smears used in staining procedures? Control smears verify that staining reagents and techniques are functioning correctly and help identify staining errors before patient samples are reported. What organisms are commonly used as controls for gram staining? A mixed broth culture of staphylococci, that is gram positive cocci, and E. coli, that is gram negative bacilli. For gram negative bacilli can be used. Otherwise, we use ATCC strains of Staphylococcus aureus and E. coli. Why should stain containers be non-leaking and light proof? Uh, to prevent the evaporation, to prevent contamination, preserve the stain stability, and reduce the wastage. That is why we use them as non-leaking and light proof. Because uh, if the bottle will not be light proof, it may not the stain may not remain stable. What is the common cause of poor gram staining? Preparation of an excessively thick smear. So, common cause is that when you make the smear, then that smear thickness should be appropriate, so that if you want to read a newspaper, then you can read the newspaper easily through that smear. Or how can a thick smear affect the gram stain interpretation? Incomplete decolorization may occur, causing gram negative organism to appear gram positive. So, if incomplete colorization may take place due to the thick smear. Now, coming to the control of equipment, what records should be maintained for laboratory equipment? Each equipment should have operating instructions, cleaning instructions, maintenance records, and service logs. So, operating instructions should be there, that how you are going to use it, then after use how will you clean it, and if any maintenance is required, then that should be written, and if you have asked for the services, it should be there in the records. Which equipment parameters require daily monitoring? Operating temperatures of refrigerator, incubators, water bath, and heat blocks. So, at what temperature they are working, that is very important, and you should record it daily. So, temperature should be recorded daily for the equipment. Why should reusable laboratory items be regularly inspected? So those items which are reusable, they should be inspected regularly. Why? So to ensure cleanliness of it, sterility of it, absence of damage, and proper functioning, because you are using them again and again. So all these things should be noted down. What should be checked in specimen containers? Now, bottle cap should be checked, tube closures should be checked, then rubber liners should be checked, and evidence of leakage. So these are the specimen containers. So all these things should be intact, then only leakage won't take place. Post analytical stage. What are the major SOP requirement during the post analytical stage? So reporting and verification of result is important, because major SOP standard operating procedure requirement for post analytical means once the processing has been done in lab, then you should report and verify the results. Appropriate action for significant findings. If there is any significant finding you have noted, then immediately you should take action. Correction interpretation of the report, and correct interpretation means whatever report has come, it is the duty of the microbiologist to see and to interpret the report. Why is standardization of microbiology reports important? It ensures uniform terminology, better communication. So standardization is important. You should not use different words for different things. So uniform terminology is important, better communication is important, reduced ambiguity, improve clinical interpretation. What should be done after issuing a preliminary microbiology report? So a full written report must follow the preliminary report. Preliminary report is that which you can send to the clinician so that he can take action urgently, and then once your report is finalized and properly well written report can be sent as the final report. What is the role of the rubber stamps templates in microbiology reporting? They help standardize report formats and improve reporting consistency. So, rubber stamps templates in microbiology reporting, they standardize, because once you have written the whatever you want to write in for one time, that can be reused again and again and it will remain same. So this is going to maintain the consistency. Who should verify the microbiology report before release? The person responsible for the microbiology department or laboratory. Why is communication between clinician and microbiologist important? Effective communication improves report interpretation, clinical usefulness, patient management. External quality assessment. What is external quality assessment? What is the objective of EQA program? To verify that SOPs are followed, internal quality control is effective, laboratory performance is satisfactory. In external quality is when you are sending your sample outside and they your sample should have the same report as other people are having. Then that shows ki from external person you is assessing your quality of work. What are the benefits of EQA? So EQA is identifies error. So EQA, you come to know whether if any error is there. It also improves the quality. It motivates the staff. When they get good marks, they feel like, oh, we are doing good work. Then assures users about reliability of the result, and you can prove them to see what result we have got. Other labs are getting the same result. So how often EQA be conducted according to WHO recommendations? Monthly, 4 times per year. So at least monthly or 4 times per year, that is what happening with us. How should EQA specimen be processed? Exactly like routine clinical specimens without recognizing them as QC sample. You should not treat them very in a different way. So this is one of the important thing. Collection of microbiological specimens. What factors influence the value of microbiological report? Quality of specimen, time between collection and processing. So quality of specimen and time between the collection and the processing. So these are the factors which influence. If your quality won't be good, if there is not a pathogen in that and contaminated sample is there, then you won't get the right results. And other thing is, if there is a lot of time has been wasted between collection as well processing, then there are chances of degradation of the sample and contamination. What instructions should laboratories provide regarding specimen collection? Type of specimen, quantity required, collection method, timing, preservation requirement, transport requirement, and labeling instructions. So regarding the specimen collection, you should instruct that what type of specimen, because you only know that what specimen you want, then how much quantity you want, because you have to put it for different tests. Collection method, what collection method you want. Timing, whether before giving the antibiotics, after giving the antibiotics, what timing, when there are some diseases when you need the sample in the morning, sometimes you need the sample in the evening, so that all you have to tell them. If any preservation is required, if you feel like, if you think that there may be any organisms which are fastidious in nature and very fragile, then you have to tell them about the preservation and the transport requirement, labeling instruction, what all they should write on the labels. What are the essential components of specimen collection instructions? So essential component of the collection instructions are type and amount of the specimen, best collection time, aseptic collection method, labeling requirement, storage and transport condition. Type of specimen. So why is proper specimen selection important? The likelihood of isolating the causative pathogen depend on obtaining the correct specimen from the correct site. Why is cervical or vaginal swab preferred for gonococcal isolation? Because it provides the highest yield of Neisseria gonorrhoeae. Time of collection. When is sputum best collected? So when is sputum best collected? Early morning after waking. When should blood culture ideally be collected? When the patient temperatures begins to rise. Why should specimens be collected before antimicrobial therapy? Antibiotics may suppress or kill pathogens, reducing the culture yield. Collection techniques. What is the main principle of microbiological specimen collection? Collect specimens so that only organisms from the infected site are present. Why is aseptic technique important? To prevent the contamination, ensure accurate culture results, protect the patient, because we just want pathogen from the sample, we don't want any contaminant, and organisms are present all over the environment, air, everywhere. Bacteria may be present, so it may contaminate the sample. We don't want that. We don't want our patient to be infected also. Which specimen require strict aseptic collection? Blood, CSF, sterile fluid effusion. So these are the where aseptic collection is required, because these are sterile sample, there are no chance of organism in that, so we don't want any organism from outside, and don't want to give the report which is not correct. What characteristics should specimen containers have? They should be sterile, leak proof, easy to open, dry, free from disinfectants. Now coming to the labeling of a specimen. What information should be included on specimen labels? Patient name, identification number, ward, date of collection, time of collection. Very important. Why must request form accompany every specimen? To provide relevant clinical and laboratory information necessary for processing and interpretation. What you want, it should be there on the request form. High risk specimens. Which specimen should be labeled high risk? Specimens suspected to contain Mycobacterium TB, Vibrio cholera, Salmonella typhi, Anthrax bacilli, Treponemes, HIV, viral hepatitis viruses, viral hemorrhagic fever agents, and plague organisms. So they are considered high risk. How should high risk specimen be transported? In sealed leak proof container with clear warning label. Warning label should be there, it should be a leak proof container. Coming to the transport media. Why should a specimen reach the laboratory quickly? To maintain pathogen viability. So why should a specimen reach the laboratory quickly? To maintain the pathogen viability and to prevent the overgrowth of contaminants, improve the diagnostic yield. What is the purpose of transport media? to maintain the viability of the organism during the transport, because these are very fragile organisms, so they need whatever they require during the transport, and that all is being provided in the transport media. What is ME's transport medium used for? Transport of swab specimen, particularly delicate organisms such as Neisseria gonorrhoeae. So, Neisseria gonorrhoeae, we use this ME's transport medium for that. What is Carey Blair medium used for? Transport of stool specimen like Salmonella, Shigella, Campylobacter, Vibrio species. So, because it is a stool specimen, we are going to provide something important. So, in the Carey Blair medium, which is required by the stool organisms like Salmonella, Shigella, Campylobacter, and Vibrio species. Why should formaldehyde containing preservatives not be used for microbiological culture? So, it should not have formaldehyde, because formaldehyde kills living microorganism and we want to culture them. So, if they will be killed, how will they culture? Transport of specimen. What is the role of refrigeration during transport? At 4 to 10 degrees centigrade, refrigeration preserves pathogen, reduces multiplication of the contaminant. Which pathogen should not be refrigerated? Haemophilus species, Streptococcus pneumoniae, Neisseria species. Cold temperature may kill these organisms. So, at cold temperature, they may be killed because they want body temperature. How should smears for gram staining be transported? After air drying, protect them from dust, insect, physical damage. Dispatch of a specimen. What record should be maintained during specimen dispatch? Why should specimen containers be checked before dispatch? To ensure they are leak proof, intact, and properly sealed. Otherwise, it may cause infection to the person who is doing the transport, and when the person will open your vial at the lab, they won't find anything. So, safe working practice. What are the key biosafety principles in microbiology laboratories? No mouth pipetting, use aseptic technique, wear PPE, wash hands regularly, proper waste disposal, and minimize the aerosols, because all these things may lead to infectious disease to normal person if they are going to touch you or the material. Why should aerosol generation be minimized? Aerosols are major root of laboratory acquired infections, because if they are present in aerosol, one can breathe in the infection with the air. What personal protective equipment should microbiology personnel use? Laboratory coat, gloves, face mask when indicated, eye protection when necessary. Why should food and drink be prohibited in the laboratories? To prevent accidental ingestion of the infectious agent. Why are sharp injuries particularly dangerous in microbiology labs? They may result in transmission of the bloodborne pathogens and other infectious agents. What should be done after a laboratory spill? Then decontaminate immediately, follow spill management protocols, report the incident. So, decontaminate immediately and then you follow the spill management protocols. Microorganisms of the medical importance. So, what is a pathogen? A microorganism which is capable of causing disease. What are the major groups of medically important organisms? We all know bacteria, viruses, fungi, protozoa. There is one thing now also there, that is known as prions. Then what is infection? The invasion and the multiplication of the pathogenic organisms within the host. So, if it invades as well as it multiplies, then that is known as infection by the pathogen. So, it is pathogenic microorganism.